Hey everyone, welcome back to another video. In today's video, we're going to talk about Canadian physician assistants versus nurse practitioners. So let's get started. If you want to gain more information about nursing or to improve your nursing knowledge in general, please consider subscribing down below. I upload a video every single week and you don't want to miss them. I also have free resources you can check out down in the description box below, such as a free NCLEX guide, which I use to pass my NCLEX, and a free fitness and nutrition guide that can help you live a better and healthier life. So before I begin, I would really appreciate it if you give this video a thumbs up. I spent so much time researching all the information about physician assistants and nurse practitioners, so it would really help this video get out there if you give the video a thumbs up. So let's get on with today's video, which is Canadian physician assistants and nurse practitioners. So despite what people believe, there are Canadian physician assistants in Canada, but they can't practice in all provinces yet. They can only practice in 4 provinces, and the schools for physician assistants are only found on the East Coast. However, the nature of their job is very similar to nurse practitioners. They're both that mid-level provider of care. Nurse practitioners are more well-known in comparison to physician assistants and are therefore easier for the average citizen to understand in terms of their scope of practice. So do I believe that nurse practitioners are better than physician assistants? No, I wouldn't say that one profession is better than the other. I think both are very helpful and they work in a team environment, in a team atmosphere to provide care for patients. And as many of you know, we're in a shortage of providers, so the more we have, the better. So I really want to break off this video into 3 different segments, which is the first segment is going to be about the scope of practice and limitations, comparing a physician assistant and a nurse practitioner. The next section I really want to talk about is the schooling and the amount of training required for a physician assistant versus a nurse practitioner. And the last thing I want to talk about is the salary between a physician assistant and a nurse practitioner. So let's go ahead and talk about the scope of practice. Like I kind of mentioned, a physician assistant always has to work under the supervision of a physician. Well, which settings do they work at? Generally, the physician assistant works in an inpatient hospital setting in Canada. At least that's what the research I found said. However, it doesn't mean that they can't work in a primary care clinic, in a women's health clinic. From my research online, I found that most physician assistants work in a subspecialty setting. That could mean like cardiac physician assistants, they could work in the ER, they can work in surgical settings, and depending on what you specialize in, I guess, in your training, you work in those settings. But in general, they work in inpatient hospital settings. Another difference is, like I said, the awareness about the physician assistant profession in Canada. That kind of hinders their image because, if you ask a lot of people what a physician assistant does, most people would think that they do, clerical work, like they do the checking patients in. They think of them as a unit clerk. So that name to their scope of practice doesn't really match, in my opinion. And unfortunately, the awareness of what a physician assistant does is a lot worse than a nurse practitioner. And it's unfortunate that it is that way, but I just found through my research and a bunch of videos that I watched, that's what the general consensus was for physician assistants in the US, let alone Canada, where it's a lot less well known. Another key difference in the difference between a physician assistant and a nurse practitioner in terms of practice is that nurse practitioners have the ability to work independently. So nowadays, a few days ago actually, an article came out stating that there's a nurse practitioner-led clinic. So nurse practitioners are more well regarded and are getting more autonomy in their practice in comparison to physician assistant, which that unfortunately will not most likely change. They'll always have to be under a physician assistant. Now, I know this video is specifically talking about Canada, but in the States, if you were to work as a nurse practitioner, there's different states that you don't even need a physician to be under you. You can work autonomously as a nurse practitioner. And as for the settings they work at, I think primarily nurse practitioners work in a clinic of some sort. They don't generally work in an inpatient hospital setting. So that's a little bit different. In general, they're very similar though. They're, like I said before, they provide that mid-level mid-level provider scope of practice where they can, diagnose, they can prescribe, they can treat all types of patients. And I would assume that if things get a little bit complicated, they can refer to a physician for guidance on how to best take care of a patient. Next, I want to talk about the education requirements for applying to physician assistant school versus nurse practitioner, and which route is faster in getting you to that mid-level provider status, if that's what you're hoping for. So, as a physician assistant, to apply for physician assistant school, you need to at least have a bachelor's of science in a healthcare related field. So that means that you don't have to do bachelor's of science in nursing. There could be many different bachelor options and routes that you decide to take, and you can apply for the physician assistant program. Generally speaking, the physician assistant program is a 2-year post-bachelor's program depending on which school you go to, and I would assume that you need a lot of healthcare experience, and you need to kind of provide them with a lot of emphasis on why you think you want to be a provider, because it is quite a bit of a huge leap from going to a bachelor's of public health or whatever it may be to being a provider. So now let's talk about nurse practitioner. So as a nurse practitioner, you need to at least have your bachelor's of science in nursing. In Canada, to be a nurse practitioner, you need to do a master's program. Generally speaking, I haven't seen any doctors of nurse practitioner, although you could get a PhD, of course, but I haven't seen that DNP route that is so well known and recognized in the States. In Canada, it's mostly a master's program. And generally speaking, you need to do 2 to 4 years of education in that master's program in order to get that get the license and become a nurse practitioner. However, before applying to nurse practicing school, you need to have a bachelor's, you need to practice as an RN, which means you need to pass your NCLEX, and you need to have approximately 1 to 2 years of clinical practice. So if you add it all up, you need to do 4 years of bachelor's of science in nursing. You need to do 1 to 2 years. So let's be conservative and say a total of 5 years before you can apply to nurse practitioning school. And depending on the nurse practitioning program, it can take upwards of 2 to 4 years. So in general, it will take a total of 7 years. Whereas a physician assistant, you can do a bachelor's in 4 years and then do your 2-year post-bachelor's program. So you save about a year. So it takes you 6 years to be a physician assistant. That is, of course, if everything works out perfectly, you get your bachelor's in 4 years and you apply to physician assistant school and you get in right away, and then you become obviously a physician assistant. However, a nurse practitioner, you need a minimum of 7 years, and like I said, that means that you pass your NCLEX, you get into nursing school the first time, you apply for nurse practitioning school, and you get into nurse practitioning school the first time. All of these different things make it more challenging, in my opinion, to be a nurse practitioner versus a physician assistant. So now let's talk about the salaries of physician assistant versus nurse practitioners. So if you take a look in the description box down below, I listed all the provinces that provide the compensation they provide for each profession, depending on where you live. So salary really depends on which province you live, as cost of living obviously changes from state to state. However, in Canada, physician assistants make to upwards of $81,000 starting to an upwards of $102,000 a year. However, nurse practitioners make between $87,000 to $101,000. So depending on where you live, obviously these numbers are a little bit different. For example, in British Columbia, nurse practitioners make to upwards of $94,000 all the way up to $165,000. Whereas if you were living in, let's say, Alberta, or let's say Manitoba, you make starting wage of $85,000 and you work your way up to $106,000. Same thing for physician assistants. So if you're a physician assistant and you work in Nova Scotia, you can make upwards of $69,000 all the way up to $121,000. So as you can see, it varies from province to province, and of course, if you have more experience, you're going to get paid more. But in general, that's the ballpark of the compensation for these mid-level providers. I will also say that getting this information was not easy. It was difficult, and a lot of times I had to resort to looking at Indeed for this information, or I would have to look at certain documents that would provide compensation reports. The physician assistant one is probably the most accurate, as the Canadian Association for Physician Assistant provided those salary numbers. So take a look at them in the description box below, and let me know if you're applying for physician assistant school, or you're applying for nurse practitioner, or you're gonna stay as a nurse, and that's perfectly fine as well. All right. That's going to be the end of this video, guys. I hope you enjoyed it. If you did, please consider giving it a thumbs up. It took me a very long time to research all the different numbers in different provinces, which you can take a look at, like I said, in the description box. So I'd greatly appreciate it if you give it a thumbs up and subscribe down below. I upload a video every week and you don't want to miss it. Also, leave me feedback in the description box and let me know if this type of video is something that interests you, if you want me to make more videos like this. Anyways, we'll catch you in the next video.